I am Dr. Jayakumari, Professor, Department of Pharmacology, School of Pharmaceutical Sciences. Today I am going to take about the pharmacological classification of crude drugs. Pharmacological classification, grouping of crude drugs according to the therapeutic action or pharmacological action, or most of the important constituents of the therapeutic use is termed as a pharmacological or therapeutical classification of drug. This classification more relevant as mostly followed the method. Drugs like digitalis, Crude, Strophanthus have cardiotonic action. They are grouped under the cardiotonic drug irrespective of their parts of the plant they are obtained at and their phylogenetic pathway as well as irrespective of the nature of the phytochemistry they contain. This is a table which represents the different types of classification of the pharmacological classification of the crude drugs. And the drugs which are used as a cancer treatment, they are called anti-cancer. Example, Vinca, Phyllotoxis, anti-inflammatory drug, antihistaminic drug, ephedra and vasaca, anthelmintic drug, antispasmodic, astringent drug, ornatives, coriander, fennel, clove, purgative drug, senna and rhubarb, expectorant, tulasi, balsam of tolu, vasaca, cardiotonic, digitalis, Crude, Strophanthus, tranquilizer, Avulfia roots. Then the classification also grouped, the drugs also grouped in that classification, drugs acting on GAT drug, drugs acting on respiratory system, drugs acting on cardiovascular drug, drugs acting on autonomic system. So in GAT there are different type of mechanism of action, bitter drug, carbonative drug, emetic drug, anti-amoebic, laxative, purgative, cathetic. So each one the drugs are classified. Since the drugs are obtained from different organ of the plant, they containing different chemical constituent. Due to similar action, they are classified under one group. Next, respiratory system drugs acting, expectorant, antitussive, bronchodilator. The same thing, drugs acting cardiovascular, cardiotonic, digitalis, Strophanthus, cardiac depressant, Cinchona veratrum, antihypertensive, Avulfia. Next one, drugs acting on the adrenergic system, cholinergic drug, anticholinergic drug. Same thing, drugs acting on central nervous system, central analgesic, CNS stimulant, CNS stimulant, depressant and analgesic. Like that, some of the specific use like antispasmodic, anti-cancer, drugs acting on the skin membrane, immunomodulatory, immunizing agent, anti-malarial, these are also the drugs are classified. So here the drugs are classified or grouped mainly based upon its therapeutical action and medicinal value and pharmacological actions. Still it is a very good classification. There is one book is called Yenken Textbook of Pharmacognosy. It follows this type of classification. It has its own advantage and disadvantage. What are the merits of this classification? It can be used for suggesting substitute of drug if they are not available in a particular place or point of time. For example, in case of cardiotonic, digitalis, Strophanthus are used as school. Suppose digitalis is very costly, it is not available, we can replace a substitute drug since it has a similar use, example skill. Even though it has a maximum potent property and everything, some disadvantages are there practically we cannot follow it exactly. Drugs having different type of action, medicinal value, therapeutic action on the body, they are get classified in separate two different pharmacological group. So this causes some ambiguity or confusion to the evaluator. Example, Cinchona. If you take a Cinchona classified under anti-malarial drug since it containing quinoline alkaloid treatment of malaria. It also grouped under the drugs containing antiarrhythmic drug because of the presence of quinidine, it is isomer of quinine. It also good treatment for the abnormal rhythm of the heart, so antiarrhythmic drug. So in such a case, Cinchona can be grouped in both anti-malarial as well as in antiarrhythmic drug. So it has some confusion. This is a major disadvantage. This can be overcome by chemotaxonomy and other type of classification. Thank you, students.